Did you know that most people only find out they have a weak heart when it's too late? Stress, poor diet, and lack of exercise are among the biggest villains that can compromise your heart health. This leads to constant tiredness, lack of energy, and in serious cases, serious risks to life. But the good news is that you can avoid all this. With a few simple changes in habits, you can strengthen your heart, gain more energy, and ensure a long and healthy life. Shall we find out how? Today we're going to talk about a very important subject, your heart. Have you ever stopped to think about whether it's working properly? Perhaps you felt strange tiredness that never goes away, shortness of breath, swelling in your legs, and wondered, is my heart weak? I'm going to explain what happens to the body when the heart is weak or enlarged, what the risks are, what causes it, and of course, how we can take care of it to prevent the problem from getting worse. So stick with me to the end, because understanding more about heart failure can make all the difference to your health and that of the people around you. Weak heart, what is it? But first, have you subscribed to the channel yet? Don't waste any time, because this series of videos will bring you valuable tips to improve your health, and you won't want to miss out. Moving on. Have you ever heard of heart failure? It's when the heart can't pump blood strongly enough to the rest of the body. Imagine that the heart is like a pump that needs to push blood through all your veins and arteries. If this pump is weak, the blood doesn't circulate properly, and as a result, some parts of the body don't receive oxygen and nutrients as they should. This can cause various problems. You feel very tired, as if you're always low on energy. Walking short distances, or even climbing a few steps can feel like a marathon. In addition, the body can begin to retain fluids, which causes the legs and feet to swell. In more serious cases, the person feels short of breath even when resting. Why does this happen? Several things can cause the heart to weaken. Sometimes it's the result of years of poorly controlled high blood pressure or diabetes. Other times, it's because the person has already had a heart attack and this has damaged the heart muscle. It can also be due to diseases that affect the heart muscle directly, such as cardiomyopathy. In Brazil, heart failure is a very serious problem and affects the quality of life of millions of people. Before the pandemic, it was the leading cause of hospitalizations among people over 65. In other words, it's very common and, unfortunately, quite dangerous. The person begins to have difficulty doing the simplest of everyday tasks and, over time, will need expensive medication and frequent visits to doctors. Not to mention the emotional burden, because when the body doesn't respond well, even the will to live and enjoy the good things in life goes away. The sooner you find out, the better. But here's an important piece of news. The sooner you find out that your heart is in trouble, the more effective the treatment can be. There's no point in waiting for the problem to get worse. With the right treatment, you can avoid repeated hospitalizations and greatly improve your quality of life. It's that old story, prevention is always better than cure. If your doctor discovers that your heart is starting to weaken, he or she can prescribe medication to help your heart work better. In some cases, changes in diet and light physical activity can make a huge difference. This helps to break the vicious circle that makes heart failure worse over time. Not to mention the fact that you'll feel much better and more ready to enjoy life. Enlarged heart, what is it? You may also have heard of an enlarged heart. This means that the heart has become larger than normal because it is trying too hard to pump blood. This is another sign that the heart isn't working as it should. And the more it enlarges, the harder it is for it to fulfill its function of pumping blood, which can lead to further health problems. What should you do if your heart isn't working properly? If you're experiencing any of these symptoms, constant tiredness, shortness of breath, swelling in the legs, difficulty breathing when lying down, it's very important to see a doctor. These signs may indicate that your heart is weak and needs attention. It's not because you're older or have a health problem that you have to live with it. Heart failure can be treated, and the sooner you start, the better the outcome. So be sure to pay attention to your body's signals. Sometimes the tiredness you feel may not just be because you're low on energy, it could be your heart asking for help. A common problem, but one that can be controlled. Did you know that after the age of 70, 1 in 10 people can develop heart failure? It's quite common, but that doesn't mean we have to accept it as normal. The sooner we take care of our heart health, the more likely we are to grow old well and with quality of life. And, of course, nobody wants to go through long, repetitive hospitalizations, right? That's why it's essential to take care of your heart health, even if you're not feeling anything serious right now. And if you know someone who has experienced heart problems, share this information. Sometimes we don't give it much thought, but knowing about the risks and signs of heart failure can save lives. So that's it. Keep an eye out for the signs, take good care of your heart, and seek medical help whenever something seems strange. And if you liked these tips, leave your like, subscribe to the channel, and activate the bell so you don't miss out on more content like this. And of course, share this video with your friends and family. After all, when it comes to our health, it's always good to spread the word. Now tell me, have you ever had any problems with your heart? Are you experiencing any strange symptoms? And where do you live? Comment down here, because your story could help other people to be more aware of their heart health. I'm going to explain what heart failure is in more detail. Our heart is like a pump that needs to send blood to the whole body. When it's working well, the blood circulates properly through the organs and tissues, carrying oxygen and important nutrients. But when you have heart failure, this changes. The heart can't pump the blood as well as it should, and this ends up causing some serious problems. One of these problems is that the blood can start to back up into the lungs, causing them to fill up with fluid. The person starts to find it very difficult to breathe, feels short of breath, and sometimes has a dry cough that won't go away. This accumulation of fluid in the lungs is something called acute pulmonary edema, and it's a very serious condition. Imagine trying to breathe with your lungs full of water, as if you were always underwater. This can even lead to the person needing emergency medical attention. Another thing that can happen is that the liquid accumulates in the legs and feet, leaving these areas swollen. This swelling is called peripheral edema. The legs can become so swollen that the person can barely walk or even put shoes on. This type of swelling is not only uncomfortable, but also shows that the body is suffering from poor blood circulation. Now, did you know that heart failure is a problem that affects many people? It is estimated that around 65 million people worldwide have this problem. This shows how important it is to understand more about this condition, because it can happen to anyone, and knowing what to do can save lives. There are two main types of heart failure, and understanding the difference between them is important. The first type is heart failure with reduced ejection fraction. But what does this mean? Well, let's think about what ejection fraction is. It measures how much blood the heart is able to pump with each beat. If the heart is unable to send much blood to the rest of the body, we say that the ejection fraction is reduced. This means that the heart is weak and not doing its job properly. The second type is heart failure with preserved ejection fraction. In this case, the heart can pump blood, but it has other problems. The heart muscle may be stiff or rigid, which means that it can't fill up with blood as it should before pumping. So, even if the pumping seems normal, the heart isn't working properly, and the person may experience symptoms similar to those with a reduced ejection fraction. Now let's talk a little more about the numbers. When doctors talk about ejection fraction, they use percentages to understand how well the heart is working. If the ejection fraction is greater than or equal to 50%, this means that the heart is managing to pump a good amount of blood, and this is called a preserved ejection fraction. But if the ejection fraction is between 41% and 49%, this is what we call a borderline ejection fraction, which means that the heart is not weak, but also not as strong as it should be. And if the ejection fraction is less than 40%, then we're talking about a reduced ejection fraction, which means that the heart is quite weak and needs urgent medical attention. These percentages help doctors decide on the best treatment for the person. For example, if the ejection fraction is less than 55%, this is no longer considered normal and is a sign that something is wrong. In such cases, the doctor will order further tests to investigate the cause of the problem. To measure the ejection fraction, the most common test doctors use is an echocardiogram, which is a kind of ultrasound of the heart. It can show how the heart is working and measure how much blood it is pumping. But there are other tests too, such as cardiac magnetic resonance imaging and scintigraphy, which help to see the heart in detail. The echocardiogram, however, is the most commonly used because it is simpler and more accessible. Now that you've understood what ejection fraction is, I'll explain a little more about the two types of heart failure. In the case of heart failure with reduced ejection fraction, the problem occurs mainly in the left ventricle, which is the part of the heart responsible for pumping blood throughout the body. When this ventricle becomes larger than normal, it loses the power to circulate the blood and, as a result, the ejection fraction decreases. In the case of heart failure with preserved ejection fraction, the ventricle may be the right size, but it doesn't relax enough between beats, so it doesn't fill with blood as it should. So, to sum it all up, heart failure is when the heart is unable to pump blood properly, and this can cause many problems, such as difficulty breathing, swelling in the legs, and extreme tiredness. There are two main types, one in which the heart is weak and can't pump strongly, reduced ejection fraction, and another in which the heart doesn't fill with blood properly, even though it pumps normally, preserved ejection fraction. Understanding these details is important, because it helps you recognize the signs and seek treatment as soon as possible. I'm going to explain in more detail what happens when the heart isn't working properly. There are two main types of problems that can occur with the heart, and it's important to understand how each one affects the body. In the first type, the heart becomes weaker and is unable to pump blood to the body efficiently. This means that with each beat, it doesn't send enough blood to the organs and muscles. In the second type, the heart, which should be flexible to fill with blood, becomes harder and thicker, as if its muscles had hardened. Because of this, the heart doesn't relax properly between beats, so it doesn't fill with blood as it should, which also affects pumping to the body. Now you may be wondering, how do we tell that someone's heart is weak? Well, the body gives several signals, and one of the first and most important is shortness of breath. This happens because when the heart is unable to pump blood properly, fluid starts to accumulate in the lungs. This accumulation of fluid makes breathing difficult, and the person can feel as if they are always out of breath. Can you imagine trying to run or even walk with lungs full of water? This is why people find it difficult to breathe, especially when they are making an effort, such as climbing stairs or walking long distances. This symptom even has a specific name, dyspnea, but in everyday life, people often say that they feel tired or that they are panting. Another common symptom is swelling in the legs and feet. This happens because the blood is not circulating well, and the fluid that should be going to the organs ends up accumulating in the lower parts of the body, such as the legs, ankles, and feet. The swelling may start off mild, but it gets worse throughout the day. In the late afternoon or evening, the legs can be much more swollen. If you squeeze the ankle of a person with this problem, your finger will sink into the skin and the mark will take time to return to normal, as if you were squeezing a loaf of bread. This phenomenon is called locker. Swelling can also be noticed by rapid weight gain, but this extra weight is not due to food, but to the accumulation of fluid in the body. In addition, a person with a weak heart may find it difficult to breathe when lying down. This is because in this position, the fluid in the lungs spreads out more, making breathing even more difficult. Many people end up putting several pillows on the bed to sleep more sitting up, because that way they breathe better. This symptom is known as orthopnea, which is the name given to difficulty breathing when lying down. Another important symptom you may notice is fatigue or constant weakness. When the heart can't pump blood properly, the body's muscles and organs don't get enough oxygen and nutrients, which makes you feel very tired all the time. Even small activities, such as getting out of bed or going to the toilet, can seem difficult. This extreme tiredness is called asthenia and is common in people with heart failure. Another symptom that can be very frightening is when you wake up in the middle of the night with shortness of breath, as if you were suffocating. This is a sign that the heart is unable to keep up with the body's demands, even at rest. This symptom has a complicated name, paroxysmal nocturnal dyspnea, and can be accompanied by other signs, such as excessive sweating and palpitations, which are rapid and irregular heartbeats. In fact, when the heart is weak, it tries to compensate by beating faster. It's as if it's trying to run in order to pump more blood, but it still can't do the job efficiently. This accelerated beating is called tachycardia. Then, the person may feel their heart beating very hard or fast in their chest, which is also a sign that the heart is overloaded and trying to compensate for the fact that it isn't pumping blood properly. In addition to all these symptoms, people with heart failure can feel dizzy and even faint. This is because the blood that should be going to the brain doesn't arrive as efficiently, and without enough oxygen, the person can become dizzy or even lose consciousness. The skin can also become colder and paler, especially on the extremities such as the hands and feet, because of poor circulation. These signs may seem frightening, but they are important because they help us realize when the heart is not working properly. If you experience these symptoms, it's essential to see a doctor as soon as possible. With the right treatment, many people with heart failure can get better and lead healthier lives. When the heart is weak, it begins to struggle to pump blood around the body as it should. This can cause it to start beating in a strange way. Some people feel their heart fluttering or beating in a disorganized way, as if it were skipping beats or suddenly accelerating for no reason. This type of irregular beating is called arrhythmia. It's as if the heart has lost its rhythm, something that can be dangerous if left untreated because the blood may not circulate properly. Another common sign that the heart isn't working properly is extreme tiredness. Before, a person could climb stairs or walk long distances without a problem, but when the heart weakens, even simple activities become very difficult. Climbing a flight of stairs, for example, becomes a major challenge and the person has to stop several times to rest. This happens because the heart can't send enough blood to the muscles and they run out of energy. In addition, people with a weak heart can start to have a persistent cough that doesn't seem to get any better. This type of cough can be caused by a buildup of fluid in the lungs, which happens when the heart can't pump blood properly. Sometimes, along with the cough, the person may notice the presence of mucus, which is like phlegm, which can be white, frothy, or even pink. This is a sign that the fluid in the lungs is getting worse. A symptom that can be a little frightening is the sound of breathing, which can resemble a cat's meow. This strange sound is caused by difficulty breathing and is called cardiac asthma, which happens when the weak heart affects the lungs and causes a kind of wheezing. In addition to these symptoms, mental confusion is another sign that the heart is not working properly. When the blood doesn't reach the brain efficiently, the person can start to feel confused, have trouble concentrating, or even forget things they used to remember easily. This is because the brain needs oxygen to function properly, and the heart is responsible for getting that oxygen there. If it can't do this properly, the brain starts to suffer. A weak heart can also cause the liver and intestines to swell, resulting in symptoms such as nausea, a full stomach, and even a lack of appetite. The person may not feel like eating, even on an empty stomach, because the whole body is overwhelmed by the lack of proper circulation. The liver, for example, becomes swollen, and this affects the functioning of other organs, causing abdominal discomfort. If you have a problem with the arteries that feed the heart, such as coronary heart disease, you may start to feel chest pains. This happens because the arteries that should carry blood to the heart are clogged or too narrow, so the heart doesn't get enough oxygen to function properly, causing pain and discomfort. Another important sign that the heart is in trouble is when the extremities of the body, such as the hands and feet, start to turn blue. This means that the blood is not being properly oxygenated. The bluish color indicates that the body is not receiving the necessary oxygen, which is a warning that something serious is going on. In addition, the person's skin may become cold, especially on the hands and feet, because the blood is not circulating to these areas as it should. The person may also feel dizzy or even faint. This can happen because of an arrhythmia, which causes the heart to beat irregularly, or because of a drop in cardiac output, which is the amount of blood the heart can pump. When the blood doesn't reach the brain strongly enough, the person can lose consciousness, which is a sign that the heart is really overloaded. Another curious symptom that can occur is a change in the amount of urine the person makes. People with heart failure may start to urinate less during the day, and at night they may have to get up several times to go to the toilet. This is called nicturia, and it happens because the body is retaining fluid during the day and, when the person lies down, the kidneys start working harder to eliminate this excess fluid, causing them to have to urinate frequently at night. These are various symptoms that the body can show when the heart is weak. Each one is important and serves as a warning sign that you should see a doctor as soon as possible. Now let's talk about the causes, which are very important for understanding where these problems come from. Heart failure is the final stage of several diseases that affect the heart. In other words, it's like the last step after a heart has been damaged by many different causes. Some of these causes affect the heart directly, such as a myocardial infarction, which is when the heart stops receiving blood because of a blockage in the arteries. Other causes are more indirect, such as thyroid problems, which cause the whole body to function in an unbalanced way, forcing the heart to work harder. The main cause of heart failure is coronary artery disease. This problem occurs when the coronary arteries, which are responsible for carrying oxygen-rich blood to the heart, become clogged. This prevents the heart from receiving the oxygen it needs to function properly. Without this oxygen, the heart begins to wear out and weaken, which can lead to heart failure. Our heart is one of the most important organs in the body, and there are some things that can cause it problems, even if we don't realize it. I'm going to tell you more about these causes so that you can better understand how to look after your heart. Myocardial infarction. A heart attack is when the blood cannot reach the heart properly. This usually happens because of fatty plaques that form in the arteries and block the passage of blood. When the heart muscle doesn't receive enough blood, it becomes damaged and can stop working properly. This damage to the heart can also cause it to become enlarged, i.e., it grows larger than it should, which makes it weaker. It's like an overstretched rubber. After a while, it won't go back to normal. High blood pressure. Having high blood pressure means that the blood is passing through your veins and arteries with too much force, which makes your heart work harder than necessary. Imagine that the heart is a pump, and it has to pump harder to keep the blood circulating. Over time, this can make the heart bigger or thicker, as if it were a muscle that had grown because it was always pushing too hard. But this is not a good thing, because this kind of growth causes the heart to lose efficiency. People with high blood pressure need to have their blood pressure checked frequently and follow their doctor's recommendations to avoid overloading the heart. Heart valve problems. The heart has 4 valves that work like little doors that open and close for the blood to circulate properly. Each valve opens at one time and closes at another, according to the heart cycle. If any of these valves doesn't open or close properly, the blood won't flow properly, and this can make the heart tired and dilated, trying to compensate for the extra work. A common problem is the mitral valve, which, when faulty, can allow blood to flow back in the wrong direction. There are also cases where the aortic valve hardens, which prevents the heart from pumping blood properly, and sometimes the solution is to have surgery to replace this valve. Obesity. Many people think that obesity is just a matter of appearance, but it is a serious health problem. When someone is overweight, the heart has to work much harder to pump blood throughout the body, especially if there is a lot of fat accumulated. In addition, obesity causes inflammation in the body, as fat releases substances that make the body inflamed, which also harms the heart. Obesity can cause hormonal problems, such as insulin resistance, which is when the body has difficulty using sugar correctly. All this increases the risk of heart problems. Diabetes. Many people don't know it, but diabetes can have a huge impact on the heart. When someone has diabetes, their blood sugar becomes too high, which damages the blood vessels and the heart. In addition, diabetes increases the risk of fat accumulating in the arteries, which can lead to problems such as heart attacks and other complications. It is therefore very important for those with diabetes to take good care of their blood sugar levels and follow medical advice to protect their heart. Thyroid diseases. The thyroid is a small gland in the neck that controls many of the body's functions, including metabolism. When this gland doesn't work properly, it can affect the heart. In the case of hypothyroidism, where the thyroid works slowly, the heart rate can slow down and the heart may have difficulty pumping blood. In hyperthyroidism, where the thyroid works too fast, the heart can beat faster and irregularly, which can lead to heart failure. These changes in heart function happen because the thyroid directly influences the strength and speed of the heartbeat. Kidney disease. The kidneys and the heart are connected, and when one has problems, the other can be affected. People with chronic kidney disease, i.e., when the kidneys don't work properly for a long time, often also have heart failure. This is because both share risk factors, such as high blood pressure, diabetes, and problems with controlling fluids and salt in the body. In addition, those with heart failure often use diuretics, which are drugs to eliminate excess fluid from the body. However, when these drugs are used in very high doses, they can end up damaging the kidneys, creating a bad cycle where the heart and kidneys overload each other. Anemia and iron deficiency. Half of the people who have heart failure also have an iron deficiency. Iron is a fundamental mineral for our body because it helps transport oxygen in the blood. When iron is lacking, the body doesn't receive enough oxygen, and this makes the person more tired and lacking in energy. For those who already have heart failure, a lack of iron can make the situation much worse, as the heart has to pump even harder to compensate for the lack of oxygen. In addition, a third of those with heart failure also have anemia, which is when the body doesn't have enough red blood cells to carry oxygen to the organs. Even if there is no anemia, the simple deficiency of iron already worsens the prognosis of the person with heart problems, making it essential to treat this lack of iron with supplements or proper nutrition. Chagas disease. Chagas disease is caused by a parasite called Trypanosoma cruzi, which is transmitted by the barber bug, an insect that lives in rural areas and has nocturnal habits. When the barber bites a person, it can leave the parasite in the feces, and by scratching the bite, the parasite enters the body. Although Chagas disease has greatly decreased in Brazil in recent years, it is still one of the important causes of heart failure, especially in regions where the barber pole is still found. Chagas disease causes the heart to enlarge, i.e. grow in size and become weaker, leading to serious problems. Mortality from Chagasic heart failure can reach 20% a year, which means it is a very dangerous disease. In addition to transmission by the barber, Chagas disease can also be passed from mother to child during pregnancy, through blood transfusions and even by consuming food contaminated with a barber, such as poorly processed sugarcane juice or acai. That's why it's important to be careful when consuming these foods in risk areas. Our heart can have problems for many different reasons, and it's important to know how these things happen so that we can take care of ourselves and avoid complications. I'm going to explain some of these problems in a simple way, but in more detail. Congenital heart disease. This is the name given to problems that occur in a baby's heart while it is still forming inside the mother's womb. Sometimes the heart doesn't develop properly, and this can affect how it pumps blood. A common example is tetralogy of Fallot, which is a combination of 4 heart defects. These defects cause the blood not to circulate properly through the body. If these problems are left untreated, they can cause many problems throughout life, such as shortness of breath, extreme tiredness, and even heart failure, which is when the heart can no longer work properly. COVID-19 myocarditis. COVID-19 can cause inflammation in the heart muscle, and this inflammation is called myocarditis. This is because the virus attacks various parts of the body, including the heart. Myocarditis can make the heart weak, making it difficult to pump blood. Many people are worried that the vaccine could cause this kind of problem, but the risk of developing myocarditis because of COVID-19 is 20 times higher than the risk of getting it because of the vaccine. This means that the vaccine is much safer and more important for protecting the heart from complications caused by the virus. In addition, other viruses, such as the flu, can also cause myocarditis, so it's always good to be protected. Cardiac arrhythmia. The heart has a natural rhythm, beating regularly to pump blood. When this rhythm gets out of control, it's called an arrhythmia. Some arrhythmias cause the heart to beat too fast, as in atrial fibrillation, where the beats are so disordered that the heart can't pump blood effectively. Over time, if this arrhythmia is left untreated, the heart can dilate, become larger than normal, and weaken, which can lead to heart failure. There are many types of arrhythmia, and some can even be fatal if they are not treated in time. So if you feel your heart racing or beating strangely, it's important to see a doctor. Serious lung diseases. Our lungs and heart work together. The lungs take in oxygen from the air we breathe, and the heart pumps this oxygen to the rest of the body. When the lungs don't work properly, as in severe lung diseases, such as emphysema or pulmonary fibrosis, the heart has to work much harder to send oxygen to the organs. This extra effort can, over time, cause heart failure, as the heart is overloaded. It's as if it's been carrying too much weight for too long and starts to get tired. Chemotherapy. Chemotherapy is an important treatment in the fight against cancer, but some types of chemotherapy can have side effects on the heart. Certain drugs used in chemotherapy can damage the cells of the heart muscle, leading to heart failure in some patients. Not everyone who undergoes chemotherapy will have heart problems, but doctors usually monitor heart health closely during treatment to avoid complications. It's important to remember that chemotherapy saves lives and that doctors always weigh up the benefits and risks when choosing the right treatment. Alcoholic cardiomyopathy. Drinking alcohol excessively for many years can cause great damage to the heart. Alcohol, when consumed in excess, is toxic to the heart cells. This can cause the heart muscle to weaken, a condition called alcoholic cardiomyopathy. When the heart becomes weak, it can't pump blood properly, leading to symptoms such as tiredness, shortness of breath, and swelling in the legs. In addition, excess alcohol can cause other problems, such as cirrhosis of the liver, which makes the situation even worse. The ideal is to drink in moderation or avoid alcohol to protect the heart and the body as a whole. Other less common causes. There are some rarer causes of heart problems that can also be dangerous. For example, the buildup of iron in the heart, which happens in a condition called hemochromatosis, can damage the heart muscle, leading to heart failure. Another rare condition is non-compacted heart, which is when the heart muscle doesn't develop properly during pregnancy, leaving it with weaker parts that can cause problems with pumping blood. Although these conditions are uncommon, they show how the heart is a complex organ that can be affected in many ways. When our heart is unable to pump blood efficiently to the body, we call this heart failure. This means that the heart, which is like a pump, is getting weaker or stiff and can't do its job properly. But the good news is that there are several ways to help the heart recover and prevent it from getting worse. Firstly, doctors often prescribe medication to help the heart work better. These drugs help the heart muscle to become stronger and reduce the effort the heart has to make. Today, drugs for heart failure are increasingly advanced and effective. Even so, in some cases, drugs alone are not enough and surgery may be necessary. Now, let's understand the surgeries that can help the heart. One of them is valve replacement. The heart's valves work like little doors that open and close so that the blood follows the right path. If one of these valves is faulty, the blood won't circulate properly and this can overload the heart. When this happens, it is sometimes necessary to replace the faulty valve with a new one, so that the heart can function properly again. Another very important operation is the saphenous or mammary artery bypass graft. Sometimes the arteries that carry blood to the heart become clogged, preventing blood from passing through. When this happens, doctors use a vein or artery from another part of the body, such as the leg, saphenous vein, to create a bridge and divert the blood along an alternative route. In this way, blood flow to the heart improves, and the heart can continue doing its job. For some cases, instead of major surgery, doctors can place a stent. A stent is a kind of very small tube that they place inside the artery to keep it open. This helps improve blood flow and prevents the artery from becoming clogged again. Now, did you know that the heart also has a rhythm? It beats synchronously like music, and this helps to pump the blood. But sometimes the heart can lose this rhythm and become out of sync. When this happens, it may be necessary to insert a pacemaker, which is a little device that goes inside the chest. The pacemaker helps the heart to beat regularly and synchronously, as if it were the conductor of an orchestra. This is called cardiac resynchronization and is very important for making the heart work better. If even with all these options the heart is still too weak, a heart transplant may be the last resort. A transplant is when the diseased heart is replaced by a healthy heart from a donor. This type of surgery is only performed in very serious cases, when no other solution will work. But the big secret to avoiding this is to take care of your heart from an early age. And how do we do that? By taking care of the risk factors. Let's talk about some of them. But wait a minute. I noticed you haven't left your like yet. This helps YouTube to keep showing you our videos, so we can keep helping you. So click like now, it's quick and free. Thanks. Let's keep going. If you have high blood pressure, it's important to control it. High blood pressure makes the heart work harder than it should, and this can wear it down over time. If left untreated, high blood pressure can cause serious problems such as heart attacks and heart failure. That's why it's essential to take your medication properly, monitor your pressure and follow your doctor's instructions. Another important point is diet. Eating healthily helps to keep your heart strong. Try to avoid foods high in fat, salt and sugar, as these can cause obesity, increase cholesterol and raise blood pressure. Prefer a diet rich in fruit, vegetables, legumes and whole grains. This will give your body the nutrients it needs without overloading your heart. It's also very important to exercise regularly. This doesn't mean you have to become an athlete, but small changes in your daily life, such as walking, cycling, or even playing more with your children or pets, will help keep your heart active and healthy. If you have diabetes, controlling your blood sugar is also essential. Diabetes is one of the heart's biggest enemies. When blood sugar is out of control, it can cause damage to blood vessels and the heart. That's why following a proper diet, taking the right medication and going for regular checkups are important steps to keep your heart safe. Another thing that can put a strain on the heart is being overweight. The more weight the body carries, the harder the heart has to work to pump blood to all parts. So if you're overweight, losing a few kilos will make a big difference to your heart. And of course, avoiding cigarettes is essential. Smoking causes a lot of damage to the heart and blood vessels, as well as greatly increasing the risk of heart disease. If you smoke, trying to quit is one of the best things you can do for your health and your heart. Finally, it's always a good idea to have regular checkups and go to the cardiologist, even if you feel fine. This helps to identify heart valve problems or other heart problems before they become serious. The earlier it is identified, the easier it is to treat. So, to sum up, Taking good care of your heart means maintaining healthy habits, treating medical conditions such as high blood pressure and diabetes, and going to the doctor regularly to make sure everything is fine with your heart. That way, you can keep your heart strong, willing, and happy for many years to come. If you enjoyed this video, don't forget to share it with more people so that they too can learn how to take care of their heart. So, what's the next video you're going to watch? Here are 2 suggestions for you to choose from. Don't forget to subscribe to the channel and see you in the next video. Thank you very much for watching.